Yeah, good afternoon, everyone. My name is Dr. Abiola Olusegun. I'm a herbal medicine practitioner in Embee Holistic Care. Now, what we want to discuss today is high blood pressure, a silent killer. Many people don't know that high blood pressure is actually a silent killer because most people does not feel symptoms when it comes to high blood pressure. So that's why we want to discuss high blood pressure today. And people have been asking that we discuss this ailment. They have been asking for a long time that we discuss this ailment. So actually, after this one, we are still going to discuss low blood pressure. But for today, we are discussing fully on high blood pressure and why it is a silent killer. Now, blood pressure is a measure of the force that is put on your blood vessels and organs, and as your blood passes through them, so the measure of the force that is put on those blood vessels and the organs as your blood is passing through them, that is what we call blood pressure. So high blood pressure is a condition in which the force of the blood against the artery wall is too high. That's when your heart is working under pressure. That is what we call hypertension. And you can have high blood pressure for years without any symptoms. That is one of the reasons we call it a silent killer. So you can have it for years without feeling any symptoms, and when you leave it uncontrolled, when you leave it untreated, uncontrolled high blood pressure, it increases your risk of serious health problems like heart attack and stroke. So that is why you must check yourself from time to time. And unfortunately, high blood pressure can be easily detected. Anybody can have the BP machine at home, so it is easily detected. So, but it is a silent killer because it is dangerous. It makes the heart work harder to pump blood out to the body, and it contributes to hardening of the arteries. It causes atherosclerosis, leads to stroke, it causes kidney disease, and it causes heart failure. So this is the reasons we said high blood pressure is a silent killer. And high blood pressure is measured in two numbers. It is counted in two numbers. We have the systolic pressure, we have the diastolic pressure. The systolic pressure is the pressure in your blood vessels when your heart beats. That's what we call the systolic pressure. And the diastolic pressure is the pressure in your blood vessels between heartbeats. That's when your heart is at rest. That is what we call the diastolic pressure. So we normally measure it as systolic over diastolic. Like for example, when you say 120/80, so that's systolic over diastolic. And it has ranges. We have the normal range, we have the elevated one, we have the stage 1 high blood pressure, stage 2 high blood pressure, like that. So the normal range is 120/80. So when it is getting elevated, that's when you have between 120 to 129 over less than 80. So that's when you say is becoming elevated. Then the stage 1 high blood pressure is like 130 to 139 over 80 to 89, while the stage 2 high blood pressure is 140 and above over 90 and above. So when you know that someone can have hypertension when it is higher than 180, that is, the systolic is higher than 180 and the diastolic is higher than 120. So when you have a blood pressure range of 180 over 120, or it is higher than that, please see a doctor right away. So people with a blood pressure reading of 140 are considered to have high blood pressure. When your blood pressure is 140/90, that means you have high blood pressure. And high blood pressure have been linked to a greater risk of heart disease, kidney failure, and stroke. When you have high blood pressure, it is very, very possible it is linked to heart disease, kidney failure, and stroke. Hypertension. in as many as 95% of high blood pressure cases, the underlying cause can be found, and we call this type of hypertension essential hypertension. This is greatly influenced by diet and lifestyle. So the link between salt and high blood pressure is especially compelling. Most people with high blood pressure are salt sensitive. It means that anything more than the minimal bodily need for salt is too much for them, and it increases their blood pressure. So there are other factors that can raise the risk of having essential hypertension. These are obesity, diabetes, stress, insufficient intake of potassium-rich foods, calcium and magnesium, and people that lack physical activity, people that does not do any exercise. They just sit in a place from morning till night, and when you drink too much, you consume too much of alcohol, you are at risk of essential hypertension. Then there is another one, secondary hypertension. Secondary, this when a direct cause for high blood pressure can be identified, and this condition is described as secondary hypertension. Among the known causes of secondary hypertension, kidney disease ranks the highest. When you have kidney disease, in fact, just know that you are at a higher risk of hypertension. And hypertension can also be triggered by tumors or other abnormalities that cause the adrenal glands. That's the small gland that sits atop the kidneys. So it can cause them to secrete excess amounts of the hormones that elevate blood pressure. Then there's another one that causes secondary hypertension, which is birth control pills, too, especially those that contains estrogen. Then pregnancy too is one of the things that boost blood pressure. Also medications that constrict blood vessels. Then certain defects that you are born with. That's when you are born with, it means congenital, something that you are born with. So when you have defects in your blood vessels, when you are born with it, all those can increase the risk of secondary hypertension. Then we have causes of high blood pressure. The exact cause of high blood pressure are not known, like we talked about the essential hypertension, but there are several things that plays a major role, and those things are smoking. When you smoke, you are at risk of high blood pressure. When you are overweight, your weight is too much. When you are obese, lack of physical activity, when you don't do exercise, especially those that works in the office. Some people, as soon as they resume in the office, they sit on that chair from morning till they close, and that is very, very bad. Lack of physical activity, too much of salt in your diet, then too much of alcohol consumption, when you take more than 1 or 2 drinks per day. Then stress causes it. Then older age, when you are getting older, you are prone to high blood pressure. Then genetics, when there is a family history of high blood pressure, you are likely to have high blood pressure. Then chronic kidney disease. This is part of what causes high blood pressure. Then adrenal and thyroid disorders also causes it. Then sleep apnea also causes it. So there are some risk factors that are associated with high blood pressure. When you are getting older, I told us that it is one of the causes of high blood pressure. When you are getting older, you are at risk of high blood pressure. So, like until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. That's if you have been watching your lifestyle, because those are parts of what causes high blood pressure too. Then race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in whites. So there are serious complications such as stroke, heart attack, and kidney failure, and they are also common in people. I told us they are common in people of African heritage. Then part of the risk is also family history. High blood pressure tends to run in families. If they have it in your family, it is likely for you to develop high blood pressure. Then being overweight or obese. I'm talking about the risk factors of high blood pressure. When your weight is too much, because the more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. So you need to watch your weight. You have to work on your lifestyle and diet. As the amount of blood flow through your blood vessels increases, so does the pressure on your artery walls also increase. So please, you have to watch your weight. Being overweight is part of risk factors of high blood pressure. Then not being physically active. These are part of the things I've told us in the causes of high blood pressure, but they are also the risk factors that are associated with high blood pressure. So when you are not physically active, you don't do exercise, you just stay in a place from morning to night. And people who are inactive tend to have higher heart rates. And the higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. So lack of physical activity also increases the risk of being overweight. When you sit in a place from morning to night, it is possible for you to be obese. It is possible for your weight to increase. Then using tobacco. Not only does smoking or chewing tobacco immediately raises your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. So in fact, I tell people, stop smoking. In fact, smoking can make you develop cancer, because nicotine can affect you. So it will not only raise your high blood pressure temporarily, but those chemicals can damage the lining of your artery walls. That's why they always write it there. Smokers are liable to die young. The only thing is, they write it faintly. It is faint. But when you are smoking, know that you are reducing your years when you are smoking. So, and this can cause your arteries to narrow, and it will increase your risk of heart disease. And also, secondhand smoke can increase your heart disease risk. Then too much of salt in your diet, that's too much of sodium in your diet. Too much of sodium in your diet can cause your body to retain fluid, and this can increase your blood pressure. There are some people, after cooking, after you have finished cooking the food, you will now say the food is not sweet. You still carry salt, you sprinkle it on the food. You are increasing your risk of high blood pressure, because even cooking the salt with it, too much salt will increase your blood pressure. Not to talk of sprinkling salt after cooking the food, then you sprinkle on the food again. You are increasing the risk of your high blood pressure. Then too little potassium in your diet. You see, potassium helps to balance the amount of sodium in your cells. So when you have too little potassium in your body, you know that your sodium will increase and your blood pressure will rise. So you must have a proper balance of potassium, because that is critical for good heart health. If you don't get enough potassium in your diet, or you lose too much potassium due to dehydration or other health conditions, sodium can build up in your blood. So you need to take potassium rich foods like banana, orange, grapefruit, raisin, and so on. Those will increase your potassium. Then when you drink too much alcohol, well, I prefer you stop taking alcohol, but at least you limit your alcohol intake, because over time, every drinking can damage your heart, and having more than one drink a day for women and more than 2 drinks a day for men may affect your blood pressure. So if you drink alcohol, please do it in moderation. Then stress. High stress levels can lead to a temporary increase in blood pressure. You know that when you undergo too much of stress, there's a hormone there is a hormone that releases into your body, cortisol. So stress related habits such as eating more, using tobacco, or drinking alcohol can lead to further increase in your blood pressure. Then certain chronic conditions like kidney disease, diabetes, and sleep apnea, all these chronic conditions can also increase your risk of high blood pressure. That sleep apnea is a serious sleep disorder in which breathing repeatedly stops and starts. Then age and obesity are the risk factors of sleep apnea. So that is why I'm always emphasizing on your lifestyle and diet. So obesity causes so many ailments, and sometimes pregnancy contributes to high blood pressure as well. When you are pregnant, it's possible for your BP to rise. Then you see, although high blood pressure is most common in adults, but children may be at risk too. For some children, high blood pressure is caused by problems with the kidneys or the heart. But for a growing number of kids, poor lifestyle habits such as an unhealthy diet and lack of exercise contribute to high blood pressure. There are some people, they will say the child is still small, the child is still little. They feed the child with so many fatty foods. They feed the child with unhealthy diet. But these things are actually piling up. It is still going to affect that child. So please, right from this time, watch the diet of your kids too, not only the adults. And there are some complications that high blood pressure can actually cause. So the excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as your organs. So the higher your blood pressure and the longer it goes uncontrolled, the greater the damage. That's the complication. So uncontrolled high blood pressure can lead to several complications like heart attack or stroke, because high blood pressure can cause hardening and thickening of the arteries. We call that atherosclerosis, and this can lead to heart attack. It can lead to stroke or other complications. Then aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, and this will form aneurysm. So if an aneurysm ruptures, it can be life-threatening. These are the complications of high blood pressure. Then heart failure is also part of the complication, because to pump blood against the higher pressure in your vessels, the heart has to work harder. So this causes the wall of the heart pumping chamber to thicken. The left ventricle, we call this left ventricular hypertrophy, and eventually the thickened muscle may have a hard time pumping enough blood to meet your body's needs, and this can lead to heart failure. Then weakened and narrowed blood vessels in your kidneys. This can prevent these organs from functioning normally. It can prevent your kidney from functioning normally. Also, thickened and narrowed or torn blood vessels in the eyes can result in vision loss. So you see that there are so many complications when you have high blood pressure. There is another one too, metabolic syndrome. This syndrome is a group of disorders of your body's metabolism, including increased waist size, high triglycerides, decreased HDL, that is high density lipoprotein. It's a cholesterol, that's the good cholesterol. So high blood pressure and high insulin levels, these conditions can makes you more likely to develop diabetes, heart disease, and stroke. So another one is trouble with memory or understanding. See, uncontrolled high blood pressure may also affect your ability to think. It can affect your ability to remember and your ability to learn. So trouble with memory or understanding concept is more common in people with high blood pressure. Then one of the complications also is dementia, because narrowed or blocked arteries can limit blood flow to the brain, and this will lead to a certain type of dementia, which is vascular dementia. So a stroke that interrupts blood flow to the brain also can cause vascular dementia. So I always tell people, you see, brain, when it comes to the brain, it is not like the stomach where you feel that you are having stomach ache, you want to take that. You don't feel all those things in the brain. The brain cells degenerate. They degenerate. So that is why you must watch yourself, watch your lifestyle. That's why I'm making this lecture a full one, so you know how to prevent yourself from developing high blood pressure. It has so many complications. Now let me discuss how high blood pressure it actually affects the kidney, how it affects the brain, how it causes stroke and heart attack, then and heart disease. You see, when it comes to heart attack and heart disease, high blood pressure can damage your arteries by making them less elastic, and this decreases the flow of blood and oxygen to your heart, and it leads to heart disease. In addition, decreased blood flow to the heart can cause chest pain, which we also call angina. So that's how it causes heart disease and heart attack. And also, when heart attack, this happens when the blood supply to your heart is blocked, and heart muscle begins to die without enough oxygen. So the longer the blood flow is blocked, the greater the damage to the heart, because the heart will not get enough blood. And heart failure, which is a condition that when your heart can't pump enough blood and oxygen to your other organs, because it is the arteries of the heart that pumps blood to other organs of the body. So that is how high blood pressure causes heart disease, heart failure, heart attack. Then how it causes stroke and brain problems. High blood pressure can cause the arteries that supplies blood and oxygen to the brain to burst, or it can make them to be blocked, and this can cause stroke. I said when the arteries that supplies blood and oxygen to the brain, when the arteries are busted or it's blocked, which high blood pressure can cause, and this will lead to stroke. Brain cells die during a stroke because they do not get enough oxygen. So stroke can cause serious disabilities in speech, in movement, and other basic activities. And stroke can also kill. Because there are some people, when they have stroke, they believe that it is spiritual. No, it is not spiritual. I'm not saying it cannot be spiritual, but it is not spiritual in most cases. It is not spiritual. So you know that when you have high blood pressure, especially when it is not controlled, you are at high risk of stroke. So having high blood pressure, especially in midlife, is linked to having poorer cognitive function and dementia later in life. So let me discuss how it causes kidney disease too. Adults with diabetes, high blood pressure, or both, those that have high blood pressure and also have diabetes, they have higher risk of developing chronic kidney disease than those that does not have these conditions, because high blood pressure can constrict and narrow the blood vessels in your kidneys, and this will reduce the blood flow and stops the kidneys from working well, because they are not getting enough blood. So the kidney will stop working well, and when this happens, the kidneys are not able to remove all waste and extra fluid from your body. Extra fluid in the blood vessel can raise your blood pressure even more and it creates a dangerous circle, and it causes more damage that leads to kidney failure. So that's how it causes kidney disease. Now, to discuss the symptoms of high blood pressure, if you have been following, you see that I mentioned 2 types of hypertension, which is essential and secondary. I said in the essential, you don't actually know the cause of the hypertension. And I told us that high blood pressure is a silent killer. Why? Because most people with high blood pressure have no signs or symptoms. That is why it is a deadly disease. There are some people, even if their blood pressure readings reach dangerously high levels, they don't feel any signs or symptoms. That is why we call it a silent killer. So, a few people with high blood pressure may have headaches, some may have shortness of breath or nosebleeds, but these signs and symptoms are not specific, and they usually don't occur until high blood pressure has reached a severe or life-threatening stage. So that is why you must watch yourself. Do a regular checkup. Blood pressure is very easy to check. The range is very easy to check. So make sure you prevent yourself from developing it. And when you have it already, please make sure you don't leave it uncontrolled. We have mentioned the complications of high blood pressure, and those really happens when you don't control it. Now to prevention, for you to prevent high blood pressure, make sure you are getting at least 150 minutes of physical activity each week. That's about 30 minutes a day, 5 days a week. You can jog, you can swim, you can walk for 30 minutes, you can dance for 30 minutes. Just make sure that you involve yourself in a physical activity for at least 30 minutes per day. And you must stop smoking. No smoking. Stop smoking. Then you eat a healthy diet. I'm not saying you should eat well, but eat right. Because some people believe that when you tell them that eat diet, there are much of fruits and vegetables, they will complain that they are not eating what they want, what they feel like eating. I usually ask people, what is that thing that you feel like eating? You want to eat chicken? You want to drink mineral? You want to drink malt? All those beverages. Is that what you feel like eating? Because your body is controlling you. You are not the one controlling your body. That is why I always tell people, I'm not saying eat well only. Please eat right. Eat a healthy diet. And please limit the sodium in your diet. And limit your alcohol intake. Also, keep a healthy weight. Please keep a healthy weight. You can keep a healthy weight when you eat a good diet, when you involve yourself in physical activity. And please manage your stress. Manage your stress. When you have too much of stress in your body, it causes inflammation, and this can lead to certain health conditions. So please manage your stress. Then there is a dietary approach to hypertension. We can use dietary approach to combat high blood pressure and reduce the risk of these diseases. We call it DASH diet, and this emphasizes on fruits, vegetables, legumes, nuts, and seeds. This diet should be low in salt. Then you avoid added sugars and avoid fatty foods. The main reason why people with high blood pressure benefit from this kind of food is because it reduces your salt intake. When you take nuts and seeds, when you take vegetables, it reduces your salt intake. When you take fruits, it reduces your salt intake. At least you will not want to eat fruit and sprinkle salt on it. So this type of diet, beyond reducing blood pressure, offers a number of benefits. It doesn't work for blood pressure alone. It also works on weight loss. It helps you to reduce your weight, and it reduces cancer risk. Though it is not purely designed for weight loss, but it also helps in reducing your weight, and it reduces your risk of cancer. It is particularly recommended for those that has high blood pressure, and they should also eat foods that are rich in nitric oxide, because high blood pressure causes the blood vessels to be narrowed such that the blood flow is restricted. And to reduce high blood pressure, blood vessels has to be expanded to allow free flow of blood. So nitric oxide plays a major role to achieve this. That's why we say they should eat food that are rich in nitric oxide. And the sources of nitric oxide, that's how you get nitric oxide, is through when you take beetroot, when you take garlic, cruciferous vegetables like cauliflower, cabbage, kale, broccoli, and so on. Green leafy vegetables like spinach, broccoli, dandelion, lettuce, and so on. Then pomegranate, all these are source of nitric oxide. Then nuts and seeds too are also source of nitric oxide. You see that these are the things I also mentioned in the DASH diet. So you take nuts and seeds like flaxseed, almonds, cashew nuts, pumpkin seed, peanuts, sunflower seed, sesame seed, chia seed, and so on. You take food that are rich in nuts and seeds. These are also part of what you can take for prevention of high blood pressure. When you make sure that your diet is high in fruits and vegetables, you take nuts and seeds. In the afternoon, you can just snack on nuts and seeds. These are also part of the prevention. And when you have the high blood pressure already, these are the foods that can also help you. Then hibiscus tea, zobo, that is also good, but I prefer if you can prepare it yourself, it is better, because there should be no added sugar, please. So if it's something you can prepare by yourself, it is also good for high blood pressure. And also there's an ailment we call renal artery stenosis. I actually want to discuss this because high blood pressure is also one of its risk factors. When you have high blood pressure, it is possible for you to develop renal artery stenosis. Renal artery stenosis is a narrowing of arteries that carry blood to one or both of the kidneys. The artery, I told us that the arteries of the heart that supplies blood to other organs of the body. So when the artery that carries blood to both your kidneys, we have two kidneys. When the artery that carries blood to one of the kidney or both, when it is narrowed, that is what we call renal artery stenosis. And this is most often seen in older people that has atherosclerosis. That's when the arteries are hardened. There is no flow of blood to the heart. So renal artery stenosis can worsen over time, and it often leads to hypertension, and it also leads to kidney damage. The body senses less blood reaching the kidneys, and it misinterprets it that as the body is having low blood pressure. If you understand it like that, I said this leads to kidney damage, it leads to hypertension, because the body will sense less blood reaching the kidney, and it will now misinterpret it that the body is having low blood pressure, because the kidney is not getting enough blood for it to work well. So the body misinterprets it as low blood pressure. Low blood pressure is not also good. I said we are still going to discuss that later on, maybe tomorrow or next. So, and this signals the release of hormones from the kidney that leads to an increase in blood pressure. Let me explain it one more time. I said the body, when you have renal artery stenosis, the body will sense that there is less blood that is reaching the kidney, and because of that, because the kidney is not getting enough blood, the body will see it that you are having low blood pressure. It will misinterpret it like that. So this will now give the kidney a signal to release hormone that, okay, oh, your body is having low blood pressure. Kidney, please release hormone to increase the blood pressure, and of which your blood pressure is actually high. But because your kidney is not getting enough blood from the artery, so the body misinterprets it. It gives the kidney signals that you have low blood pressure. So it will now make the kidney to release hormone that will increase the blood pressure. So it makes the blood pressure more higher. And over time, this can lead to kidney failure. So please, watch your health. Always go for checkup. And make sure you're always checking your blood pressure. And there are some causes of renal artery stenosis, because more than 90% of the time renal artery stenosis is caused by atherosclerosis. That's hardening of the arteries. This is a process in which plaque made up of fats, cholesterol, and other materials build up on the walls of the blood vessels, including those that are leading to the kidneys. So that's when we say someone is suffering from atherosclerosis. But more rarely, renal artery stenosis can be caused by a condition called Fibromuscular Dysplasia, though this is rare. This is when the cells in the walls of the arteries undergo abnormal growth. When those cells in the arteries undergoes abnormal growth. And this is more commonly seen in women and younger people. So fibromuscular dysplasia is potentially curable. It is curable. So there are some risk factors that are associated with renal artery stenosis. Renal artery stenosis is often found by accident in patients who are undergoing tests for another reason. It might not be that is the major reason they went to do for test, but when they are undergoing that test, they can see the renal artery stenosis. And there are some risk factors that are associated with it. When you are getting older, when you are a female, I said it's more common in female. When you have hypertension, I've told you that it is one of the risk factors. That's why I'm discussing this renal artery stenosis. Then when you have other vascular diseases like coronary heart disease and peripheral heart disease, and when you have chronic kidney disease, all this can lead to renal artery stenosis. When you have diabetes, when you are always using tobacco, when you smoke, when you have abnormal cholesterol level, when you don't control your cholesterol. So all these are the risk factors of renal artery stenosis. Then it has some symptoms, though it doesn't really have symptoms like that. It is, we said high blood pressure is a silent killer. It's a deadly disease. So when you even have the renal artery stenosis, it usually does not cause any specific symptoms. But sometimes the first sign of renal artery stenosis is high blood pressure that is extremely hard to control, along with worsening of previously well controlled high blood pressure. When your high blood pressure is worsened, when your high blood pressure is elevated and have affected other organs in the body, and when your high blood pressure is extremely hard to control, these are the symptoms of renal artery stenosis. So that is why it is found by accident. When your high blood pressure is extremely hard to control, when it has affected other organs, and maybe you went for checkup, they can detect the renal artery stenosis. So I will conclude by saying, let your food be your medicine, and let your medicine be your food. So please watch your diet. This is where we are going to stop today. We thank you for listening, and we appreciate if you can share this lecture, share it in your social media, share it so that those that are not watching us can also benefit from, because there are so many people suffering from this disease. They don't even know, because they don't have signs, they don't have the symptoms, so that at least they can check. There are some people that the last time they checked their blood pressure, they cannot remember. So please like and share this lecture so that many people can also benefit from it. And if you have any question concerning what we have discussed today or any ailment at all, you are free to speak with a doctor. You can contact us. You can drop your question here on Facebook. We'll answer you within a short period of time. And if you want to speak with a doctor, you can contact us on 081-0460-7130. You can also follow us on our other social media networks like Instagram at Embee Holistic_care, on Twitter at Embee Care. You can follow us there. You can also follow us on Facebook. So please let your food be your medicine, and let your medicine be your food. Thank you for listening. Have a nice day.